We're getting close to end of time, but I just wanted to take the opportunity to ask one more question. It's something that I've seen asked before as well, and it's just a patient asking if there's any link between PBC and anaemia.
Oh, yes. That will make a very good exam question for doctors, because there are several connections between PBC and anaemia. I did medicine in the old days in Oxford, which was a very old-fashioned place. And one of the questions I asked, we had to write essays rather than diagnosing people like you do. And one of the questions they asked is, what was the contribution of Dr. Charcot to medicine? And it was a trick question, because Dr. Charcot described 3 different diseases. So you could be a smarty pants like I was and know that Dr. Charcot described 3 diseases. There's no value whatsoever to treating any patients, but this is a little bit like it. So PBC, so anemia is very important in PBC because it's common and because it will contribute to fatigue in particular. Okay. And actually, there's a theory that iron deficiency can make itch worse. It's an interesting theory. It will contribute to fatigue. So when we are looking at people with fatigue in our structured approach, then the first step is look for anything that's going on that might make it worse. Okay, your quick wins, thyroid disease, for example, right? Itch at night, keeping you awake and stopping you sleeping. But anemia is absolutely one of those. And there are basically 3 types of anemia that people with PBC get. And of course, there's no reason why you shouldn't get any of the other types. So the 3 things that are associated, the first is celiac disease. So celiac disease, people will be aware of, it's an absorption issue around gluten in the diet. But what it does is damages the ability of the gut to absorb food. And it's particularly certain nutrients that aren't absorbed. So iron deficiency anemia is very common in that. So we always look for celiac disease in PBC patients with either anemia or with fatigue, because it's about 5% of people get it, right? Mm-hmm. So, and you'll not treat that unless you know it's there and give somebody a gluten-free diet. So anemia because you don't absorb iron because of celiac disease. The second one is a condition called autoimmune hemolytic anemia, okay? Autoimmune hemolytic anemia. And that's where the immune system targets not the bile duct cells like it does in PBC, but it targets the red cells, so it breaks them down. So it's another autoimmune process. And once you've got one autoimmune process, you're at risk of getting others. So it's an autoimmune association. This is pretty rare in PBC, but you will see it every so often. And that's treated by giving people antibody infusion. So it just needs, again, its specific treatment. And for lovers of obscure facts anywhere, and one day somebody will go on to Who Wants to Be a Millionaire, and this will be their millionaire question. And then please remember, you heard it here first. The small print, really, really arcane thing is that both autoimmune hemolytic anemia and PBC were discovered by the same person, which is Thomas Addison, the famous doctor, and he had no idea that they were in any way, shape or form connected. So it's totally coincidental that they were both described by the same person. So there you go, obscure fact of the day. And then the third one is B12 deficiency. So you get a thing called pernicious anemia, which is where you have an autoimmune process, just like PBC, just like hemolytic anemia, but this time the target cells are the linings of the stomach. Mm-hmm. And the lining cells in the stomach produce a protein called intrinsic factor that you have to absorb B12 from the diet. So you can eat B12 containing things until you're blue in the face, and you will never absorb them unless your body produces intrinsic factor, because they can't get across the gut wall. So if you don't produce intrinsic factor, you can't absorb B12, so you're B12 deficient. And the autoimmune process destroys that. Now, the treatment for that is not B12 tablets, because if the problem is you can't absorb it, then, triple the amount you take, you still can't absorb it. And that's why people are on 3-monthly B12 injections. None of those is a significant condition. None of those is harmful. None of those is dangerous, but none of those will be treated unless you cotton on to what's going on. So we have a very standardized way that we approach anemia. Now, clearly, anemia in the population is caused by other things you need to be aware of. So the one that people are always concerned about correctly is bowel cancers and diverticular disease. So across the population as a whole, the average 70-year-old developing iron deficiency anemia, you'd need to be concerned that there isn't a cancer causing it. But there are plenty of reasons. In fact, bowel cancer is not very common in our patients, but you will get investigated for those things correctly, because that's a safety first principle type of thing. So don't forget the other common things in the population. They're not associated with PBC, but common things are common, and you need to think about that. But celiac disease, B12 deficiency with hemolytic anemia, and hemolytic anemia are the 3 specific PBC causes. There you go.
Brilliant, thank you. And I just want